Hey guys, this is going to be day 2 of the hip week. We're going to follow a similar format that we did on Monday. So we're going to go through some spinal C.A.R.s, some quadruped hip C.A.R.s, and then we'll go into a 90-90 pails rails real quick. So just to get into things, if you want to get on all fours, we'll start with some spinal C.A.R.s. So hands are going to be underneath the shoulders and then knees underneath the hips. And then go ahead and come into an extended position. So I'm gonna stick my butt up in the air. I'm gonna pull my sternum on through, and then I'm gonna put my intention here. So I'm gonna be pulling my hands this way to pull my sternum through, and then I'm gonna go really slowly. If you guys wanna go slower, that would be awesome. And just pause the video, but hips up to shoulders. And then I'm gonna start again with hips. Now that I'm in this extended position, I'm gonna take a deep breath, squeeze. Now I'm gonna be pushing away with my shoulders. I'm gonna be pushing, and that's gonna drive me more into that flexion. And then I'm gonna come through vertebrae by vertebrae, just trying to articulate each part of my spine until I come back to extension. So that is 2 ways to go: hips up to shoulders, so extension to flexion, and then flexion to extension. Go ahead and try on your own, going from, let me think about it, shoulders on down, from extension to flexion, but also flexion to extension. You can just pause the video. The next thing we're gonna do is the quadruped hip C.A.R.s. Today, what I want us to do is start with a small circle and then get it bigger and bigger. That way we can feel when our pelvis wants to compensate. The other one I want us to do is, as we get bigger with these, I want us to add tension. So you're gonna squeeze your abs and flex like you're gonna do a max back squat. You're gonna push into the ground really hard, either spreading the floor, pushing through, whatever feels more natural to you. And then start to go into that bigger and bigger circle. So with this hip C.A.R., what we're looking to do is, I'll go this way. I'm gonna keep my spine neutral, so you'll notice there's a little bit of extension in my butt there. And then I'm gonna keep that. I'm gonna draw my knee into flexion. And then I'm gonna draw a relatively small circle, so my knee comes out to the side. I drop the knee down, and then I come into my circle. I'm gonna go the other way, open the knee up, but smaller than my max range and not much tension. The second one, I'm gonna go a little bit bigger. So I'm gonna keep that lumbar extension, and then now I'm gonna come out a little bit further and back through. It's really hard to talk with tension, so if you can, push into the ground, squeeze the abs, and then we can come back around, feeling the hamstring pull, and then scraping the outside of that joint. Awesome. And then one more. Now max squeeze, abs should be shaking a little bit, hands pushing into the ground, making as big of a circle as we can, and then coming back the other way. Awesome. That'll take us to 3 on that side. I'm gonna talk through these next 3, but I'm gonna talk a little bit more about the hip joint. So as we're going, set yourself up, brace the core, start with a small circle. What we're doing is we're chasing after mobility within the hip capsule itself. So not necessarily stretching out the glute muscles or the quads or the hamstrings, the things that attach in and around the hip, but the actual capsule. We've got a lot of ligaments in there and a lot of tissues. If you've heard the term labrum before, there's a connective tissue that surrounds the hip socket itself. We should be on a pretty big second rep here. And what we're doing is we're stretching and working that tissue in that hip socket. So where the femur, the upper leg bone, actually articulates in the joint, we want to open up space there and also coordinate control within that. So at least 3 hip C.A.R.s on each side, both ways, increasing the size of the circle and increasing that tension. Next thing we're gonna do, or the last thing we're gonna do it on both sides, but I want you to find your 90-90 position. So the front leg is at 90 degrees at the knee and the hip. The back leg is gonna be at 90 degrees at the hip. So if you look down, you should look something like a pinwheel.
okay? We're gonna chase after external rotation for today. So this front leg, the one that is opened up, you're seeing the inner side of your thigh, is gonna be what we're chasing after. If this position at a base is uncomfortable, sometimes we can feel cramping out here, or if we feel any pain, we wanna regress this. So I brought a pillow down. I can either regress the rotation of the hip by putting a pillow underneath the knee, and or I can sit my hip up a little bit, and that's gonna relieve pressure on both hips and allow me to get a little bit more out of this. I'm gonna do it from this position because my hips are super tight from the ambulance today. What I want us to do is turn towards this front hip. I'm gonna rotate myself so you can see my back a little bit more. This is gonna be a slightly different intent than, can you see that? I think you can see that. What we do with like a pigeon stretch, okay? We're actually stretching the glutes themselves. Like I said earlier, we're chasing after the hip socket. So where that bone articulates with another bone. So it's important that we get the positioning right. As we're sitting here, I want you guys to just breathe in this. We're gonna spend 2 minutes just in this stretch. And I want you to make sure that your lower back is in that same extended position that we did the C.A.R.s in. We don't want to round over and flex as we go into this. I want it to be nice and extended. And so I'm going to pull my lower back through, right? Boom, thinking big chest. Then I'm going to stretch over that front leg, okay? If you need, or if you can, I have the step here. I'm going to support myself, or if you have a yoga block, you can support yourself on either side. And just breathe into this position. You should feel the stretch in your glute over here, but you should feel it pretty deep inside because we're stretching the actual hip capsule itself. You should feel it, if you were to follow in your mind the bone from your knee up into your hip, should be at the very tail end of that position. Boom, boom, boom. We're just gonna breathe, slowly go deeper into it, and then we'll do a short pails contraction with the short rails before we go to the other side. Good, making sure we haven't lost that lumbar extension, that neutral spine, if you will. Just breathing nice and easy. Breathing in through the nose and out through the nose. That's gonna help your nervous system be more comfortable with this new position. Awesome. We're gonna call that 2 minutes. I don't know if it is or not. I don't have a clock. What we're gonna do for this pails contraction, so that's a progressive angular isometric loading for the fancy ones. I'm gonna take my shin, I'm gonna think about my foot starting this movement and my shin, and I'm going to start to push it down into the ground. So if you can think about trying to get your foot underneath where your knee is, but obviously the floor is in the way, I'm gonna start to push that, keeping my lumbar spine where it is. I'm gonna push a little bit harder. But I'm not gonna go into like a max effort for today. I'm just gonna go to about 20%, 30%, and then let's back it on down. Awesome. Go ahead and ramp that back up. So pushing a little bit harder. You can also push down with this back knee and this back foot to give yourself some more leverage. Awesome, let's ramp that up a little bit more. If you wanna squeeze your core, you can make a fist or squeeze a ball or squeeze a yoga block. Let's ramp it up to about 60%. So not a full-on max effort, but we're gonna hold this for about 15 seconds. Good. 10, 5, 3, 2, 1. Now what I want you to do is go ahead and stay in this stretched position, so you're still slightly leaned forward if you can, and then I'm gonna try to pick my leg up, starting with the foot, and I'm just gonna hold. So I'm just trying to lift this entire thing towards my chest. And I'm gonna hold it, It's my rails contraction. That's the regressive angular isometric loading for the fancy ones in the room. Hold, good, and go ahead and relax. Now what I want you to do is go a little bit deeper in the stretch, still staying with that neutral spine, and then breathe into this new position, okay? So we did some loading in this position. Now we're going to sink into it, again, reminding our bodies that it's okay to be in this new position. Spend at least 30 more seconds there. If you need to pause the video, if you want to pause the video, you can. If you want to do another cycle of that, go to more intensity, that's also fine. I'm gonna get rid of the block here. We're gonna come to the other side, so I'm just gonna switch which foot is in front, and I'm gonna find this new position. So one hip is gonna be different than the other. Almost everyone is gonna be a little bit asymmetrical, and that's okay. So I'm gonna adjust, see where I'm at. This one's a little bit better for me, so I'm leaving out the pillow cushion. I'm gonna sit upright, and then I'm gonna send myself forward until I feel that stretch in the very deepest part of that hip socket. And then we're just gonna hang out for 2 minutes. While you're here, again, deep nasal breathing. And if you want to, we can explore a little bit, so you can start to change the angles. Notice that very small variations in this position will make a huge difference. The joint itself has like a horseshoe of connective tissue in the pelvis. And then the femur itself is covered in all sorts of different ligaments at different layers. And so any small variation is gonna be beneficial, and it's gonna have a little bit of a different sensation if we're really paying attention to what's going on. Boom. Breathing through the nose. Nice and calm. Somebody got it. It's not me. That's good, so I'm gonna stay. Just in case though, we'll finish this video up. What I want us to do is start into our pails contraction. So just real gentle at first, 5%, 10%. Think about your foot driving into the ground. So I'm gonna match what my foot's doing here. I'm gonna think about pushing it down into the ground, trying to get my foot underneath my knee just a little bit. Good, go ahead and ramp that up just a little bit more. Staying over that joint. You can brace over things. If you've got a yoga block, you can hang on to it here. I'm gonna use the step and this pillow here. Good, ramp it up a little bit more, and then back it on down. Readjust anything that you want. We'll go to a more intense pails contraction on this one. So go ahead and start to drive that leg down, trying to rotate it so the foot is underneath the knee. You can use your back leg, you can squeeze to create more tension. More, driving it up, driving it up, driving it up. Let's get to as much as we can for right now. So 100% if you've got it. If you're at 100%, everything should be shaking. Shouldn't be able to hold 100% much longer than 10 seconds. We'll go for 5, 4, 3, 2, 1. Now immediately try to lift that leg up off the ground, keeping that chest where it is. Lift, 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 lift. Feel the inner thigh fire up. Good, and then relax either a little bit deeper or where you were at into that stretch. I'm gonna cut this video off here just in case we get a call, but spend at least 30 seconds to a minute here. Again, lower back is nice and straight. We wanna make sure that we're not rounded over, nice and upright, however deep we wanna go. And if you wanna repeat again, cycle on each side, that'd be awesome. That's gonna be your pails rails in the 90-90.